Good afternoon, everyone, and welcome to today's town hall. I'm Senator Steve Glazer. We're going to give this about another minute to let people still join. So just give this a second. I want to mention before we begin that if you have questions that you would like to ask me or members of our panel, that there's an address that should be on the screen here in just a moment where you can send your questions. I know we've gotten a number of questions already. We're going to get, I'm sure that some more as this conversation goes on. So. All right, terrific. Again, good afternoon and welcome to our town hall. I'm Senator Steve Glazer, and today we'll be discussing a topic that has become a serious health concern, and that is monkeypox. With me today, our Alameda County Health Officer, Dr. Nicholas Moss, Contra Costa Deputy Health Officer, Dr. Sophie Macuria, and we're going to hear in a few minutes from my fellow colleague in the state Senate, Senator Scott Wiener. We've heard a lot about this quickly spreading disease, some true and not so true. I thought this would be a good time to tackle the issue with facts from our local public health experts, so that we can all get a better idea of what we're facing and what we can do to keep ourselves and our families safe. I know we've had an exhausting 2.5 years staying vigilant against COVID, but it's still important to keep our guard up against other threats, other health threats that are out there. On August 1st, Governor Newsom declared a state of emergency to address the monkeypox outbreak. The state's currently urgently working across all levels of government to slow the spread of this disease, increase testing, conduct contact tracing, and to ensure that those most at risk are receiving vaccines and treatments. The California Department of Health is making a vaccine available to limit the spread of monkeypox in communities where transmission is highest and with populations most at risk. But there is currently an extremely limited supply from the Strategic National Stockpile. More doses should be arriving in California in the coming weeks. I know we're going to talk with our guests about that. And again, reminder, if you have questions for me or my guests, please email them to me now at senator.glazer@senate.ca.gov. So let me turn to our health experts. We're pleased to be joined by two of them from our counties in this area. First, Dr. Nicholas Moss is Alameda County's health officer. Dr. Moss has served as a leader in Alameda County's COVID-19 response, overseeing many aspects from data reporting to reopening policies. Dr. Moss is an infectious disease medicine specialist and medical epidemiologist by training. I understand you joined the agency in 2013. You received your bachelor's degree from the University of California, Berkeley. Go Bears. And you've got your doctor of medicine from UC Irvine. Welcome, Dr. Moss. Also joining us from Contra Costa Health Services is Dr. Sophie Macuria. She's serving as the Deputy Health Officer for the past 2 years, supporting the COVID-19 response in the county, and has now been supporting the monkeypox response within Contra Costa County. Dr. Macuria came to Contra Costa Public Health in 2016. And I understand your medical schooling spans the country, from Boston University School of Medicine to UC Berkeley. Dr. Macuria, welcome. Thank you so much for joining us. Well, let me ask some basic questions. You know, I'm not an expert on monkeypox, and I'm sure many people that are watching or listening feel the same, but they're worried and concerned. Dr. Moss, why don't we start with you? Tell us about monkeypox. How long has it been around? It has this crazy name. A lot of people wonder why. Can you share with us some of the basic facts about monkeypox?
Sure. First of all, thank you for having me, Senator Glazer, and for having this town hall. Monkeypox is, and you're going to hear, excuse me. Monkeypox is a viral illness. You're going to start hearing me refer to as MPX. Or Mpox, but I'm talking about monkeypox, the same thing. It's a viral illness. It's a relative of smallpox, and it's been known for decades, and it has caused sporadic waves of illness in other parts of the world. Occasionally, we've had cases in the US before, but nothing like this current outbreak. Typically something that spreads to people from animals, not monkeys. That was sort of a misnomer because of the way it was identified in a laboratory. I think in the 1950s, someone can correct me if I have the wrong decade there. But probably small rodents. But it can spread from person to person, and that's why we're having, I think, this discussion today. It's I think something that is posing some new and different challenges from what we've been dealing with the COVID pandemic.
Dr. Makuria, can you talk about how monkeypox is spread? How do you get it, and what kind of protection should we take to avoid it?
Yeah, I would also like to thank you for having me, Senator Glazer, as well. I'm happy to talk about how MPX is spread. It is spread from close, intimate contact, skin-to-skin contact, and really contact if someone has the rash. MPX kind of individuals who have it develop a rash, and it's usually develops into a pretty distinct rash over a couple of days. And so if someone has those, they can spread monkeypox if someone were to come into contact with them or their skin. And that's really the mode of transmission, or the way it's spreading, that we're seeing in this current outbreak that we're seeing throughout the United States and Europe.
So you mentioned skin to skin, but there's been some stories that it can be transmitted through the air, or might be transmitted from a piece of material. Can you speak to what we know? And again, I know that the research is not always all in yet, but any truth to those concerns about other ways in which it's spread beyond skin to skin contact?
It's possible for MPX to be on materials or kind of live on things, but it's not really the way that we're seeing it in this current outbreak. And the main mode of how people are getting it is really that skin to skin contact. And in terms of kind of the droplet or respiratory, and kind of MPX has been around for a long time and has been seen in other times to cause more of a potential for respiratory or droplet kind of exposure if someone were in the room with someone for a really long time, really close to them. But again, we haven't really seen that in the current outbreak. We're really seeing that skin to skin intimate contact with this current strain.
So with COVID, there was a lot of concern about, close contact indoors as being something where there's greater vulnerability. Are you saying that going to the grocery store, getting gas at the gas station, social activities, there's really no concern there? Shaking hands is okay, no concerns there?
Yeah, going to the grocery store, it's not as infectious as COVID. I know we're still seeing COVID. We're still in the COVID pandemic. And so it's not as infectious. You don't get it the same way as you get MPX as you get COVID. And going to the store, being indoors with someone who has MPX is not a concern. And it's really close contact with a rash. So if someone does have a rash on their hand and you're shaking their hands, that is a potential of getting exposed to MPX. But otherwise, if the rash is covered, really low risk.
So the suggestion of washing your hands often, as we've dealt with COVID, it would apply to this as well.
Yeah, washing your hands often and kind of washing other surfaces, general kind of cleaning that you would do for things.
Dr. Moss, Ann has written in and she asks, is there immediate testing for monkeypox, such as for COVID right now? What would you say to Ann?
Yeah, testing is widely available. Commercial labs, large commercial labs across the United States offer the monkeypox test, and most healthcare providers are able to send specimens to those labs to get it tested. I think results would be back in a day or two. So it's widely available, and if somebody has a rash that they're concerned might be monkeypox, they can go to a healthcare provider and have that rash tested and get a result pretty quickly.
Going through COVID, I know we all have scars from going through COVID. if you caught a cold, you thought you might have COVID. If you had the flu, if you had a runny nose, if you had a sore throat. And so there were a lot of elements of COVID where you wondered, maybe I need to go get tested, or I should be a little bit more concerned than I might normally be. But with the MPX, as we're calling monkeypox now, do you have that same concern? Rashes is not something that people experience often, and so therefore it may stick out more than some of the symptoms that people might have thought were COVID.
Yeah, I mean, I think from, working in medicine and primary care medicine, you actually see a lot of rashes. People come in with all kinds of skin issues all the time. And of course, the vast majority of those are not going to be monkeypox. And it is fairly characteristic with the types of lesions that Dr. Mercuria described. And actually with this current outbreak, it's been characterized by genital lesions in many cases. And those can look like other genital conditions, herpes, syphilis, all of which are things that are worth getting evaluated, getting tested. But the vast majority of rashes in people who aren't really, haven't really been around anybody with monkeypox are unlikely to be monkeypox. But if people are concerned, again, it's pretty easy to get tested these days. And I think, there should be a low barrier to testing. People should be able to go get something tested. Most rashes are probably going to be something else.
Ron has written in, after vaccination, are you still able to contract MPX, monkeypox? Either one of you, a response to that? If you've been vaccinated, are you still vulnerable?
You can go for it.
Okay, so I'll answer, and then Dr. Mercuria can correct what I get wrong. So we don't have a lot of real world experience yet with our the vaccine that we're using. It is approved for use to prevent monkeypox. We're mainly using it in people who've already been exposed, although that is starting to shift a little bit. If you've been exposed, this vaccine in the first 4 days will probably prevent illness. And in the first 2 weeks after exposure, it might not prevent illness, but it might prevent severe illness. There is experience with a similar vaccine. It showed that it was about 85% effective at preventing monkeypox. So it's not this exact vaccine, but it's very similar. And we think that that's probably a good benchmark. But we'll know more as we go, with the real world experience that we're building right now.
Dr. Mercuria, anything to add to that?
The only thing I was going to add, we do expect, because we don't have a lot of data for this current outbreak and how well the vaccine is working, and we do expect, if given within 4 days after an exposure, it would prevent the infection. But we still do ask individuals who were potentially exposed to monitor closely for any symptoms of monkeypox, and it can start for some with flu-like symptoms, but most everyone 100% will get a rash, and so really looking for the rash. And I will also say that we are mostly doing post-exposure prophylaxis, but we have transitioned a little to prevention, pre-exposure prophylaxis for certain groups, knowing that there's a lot of high-risk activity, a lot of intimate potential contact that might spread within different social networks, and so really focusing on both of those.
An individual has written in about whether or not other health conditions could affect whether you're eligible to be vaccinated or not. Obviously, something you should talk about with your primary care physician, but any thoughts on previous conditions that might create some concerns or issues?
So currently, with the current vaccine that we're using and available, there's no contraindications for the vaccination, and you can receive it. The only real reason you couldn't get it was due to an allergic reaction to the vaccine. The other vaccine that potentially is not being used right now at all, but could be used if needed, there is a lot more reasons or medical conditions where people couldn't get it. But this current vaccine that is out there and being used, anyone can get it if they're eligible or have had an exposure.
So perhaps both of you could speak to how many cases first in Alameda County and then in Contra Costa County, and then if you could speak to whether there's delays in your counties in getting the vaccination out. Dr. Moss, why don't we start with you?
Just making sure I've got this right. It's 148 now for Alameda County as of yesterday. And I think I think that's fourth in the state. Most of the cases have been in San Francisco and Los Angeles, but we do have a fair number in Alameda County. We have been working hard to open up channels to vaccination. We have vaccination in the hands of healthcare providers across the county, and also several community vaccination sites that we have partnered on that are delivering vaccine. We have a few more in the works. Supply has been low, but we do have vaccine right now, and we're trying to get it into arms as quickly as possible.
Dr. Makuria, in Contra Costa County, what's the case numbers rising, and do you have enough vaccines?
Our case count is slightly lower than Alameda right now. As of a couple of days ago, is 41, but we have been seeing increases in the cases identified every week, again within specific kind of social networks and communities. We similarly are working hard to get vaccine out there into people's arms. Vaccine supply has been limited, and it continues to be limited, so really focusing on certain groups and communities, or if people were potentially exposed. But we do have vaccine sites and pop-ups. We're throughout the county, and individuals in our county can schedule a vaccine appointment on our website at cchealth.org/monkeypox, as long as vaccine supply continues and appointments are available. And they fit kind of the criteria that is mentioned on our website as well. We also are partnering with community organizations to do pop-up clinics that are focused into reaching the population we're trying to reach for vaccine. In addition to that, we're also giving vaccine to healthcare partners and continuing talks to expand kind of that network as well.
And I'd gotten a note from Tom from the Community Mpox Control Project asking about how you're working with vaccine clinics, how the county is supporting and working with them so they can do their work. And so you mentioned that in Contra Costa, the same in Alameda County. Are you working with some of your clinics to help in that outreach?
Yeah, so in terms of just getting vaccine in the hands of clinics that can put it, deliver it to the people who most need it. Alameda County, we don't operate our own healthcare system. And so we're really relying on those community partners and clinic partners to do work like this. We are also leveraging our experience running vaccination efforts for COVID to help support monkeypox vaccination at these community sites. But again, those are also done in partnership with other entities. And so I would say, we're supporting both in terms of making sure people have vaccine, also making sure people are up to speed, trained on vaccination technique, have the equipment they need to safely operate these, even if that means just making sure there's a porta potty handy, and generally working to bring more vaccination sites online across the county.
I see a note that's come in from Matthew. He says the Concord Rainbow Community Center is in the process of opening 2 vaccine sites. So that's terrific to hear. Thank you for sharing that. So Nora writes in and she says, many older individuals have been vaccinated against smallpox, though the last time would have been in the 1970s. How long are individuals protected from monkeypox, and will they require a monkeypox vaccination? Who wants to take that question from Nora?
Go ahead.
We do expect this. The current vaccine that we're using is a vaccine that was for smallpox as well. And individuals who got smallpox vaccine a while ago may have some immunity, but we don't know really how long it lasts for individuals. And so if they fit, if especially particularly if it was such a long time ago, if they fit kind of the groups that we're focusing vaccination efforts on or have had an exposure, we would recommend that they get vaccinated at this time. In terms of lasting immunity from this vaccine, it is thought to be quite a little bit of time, but I think we're still learning exactly how long immunity will last from this vaccine, particularly after the second dose, but we do expect it will last for at least a couple of years.
Anything to add to that, Dr. Moss?
Just one thing, which is, and this is still in the realm of speculation, but I think one sort of theory about why we're seeing such a large outbreak. This is an illness that's been around for a long time, but hasn't caused an outbreak. It certainly has caused outbreaks. They've been more limited in scope. That might have to do with collectively different communities being further and further out from smallpox and smallpox vaccination, and the overall, immunity that was carried over from the smallpox vaccination, smallpox and eradication efforts starting to just wane a little bit in our communities. Again, speculation, but I think it speaks to this idea that people, if there's an exposure, even if you have a history of smallpox vaccination, most people are going to be recommended to be vaccinated in that case.
Bernice writes in, and she says, as a Delta health provider, I believe that the dental community has not received enough direction from our public health departments on how to handle patients who present with symptoms of monkeypox disease. They're mitigating against COVID as best they can. She said, I would love to know more about how the dental community can respond to this evolving public health issue in the best manner to protect ourselves and our patients. Thoughts to Bernice.
Let's see. So there's a lot in here, but a few things. First of all, I think, my gratitude to the dental health community for all that they've done to operate and figure out how to make things work and during the COVID pandemic. And, I think dental health is often sort of, we don't talk about it as much as we talk about other forms of health, but it's super important. I'm not aware of any transmission of monkeypox from a patient to a care provider in any healthcare setting. With the current outbreak, certainly in the US, I haven't heard of anything overseas. Dr. Makuria, if you have, please jump in. So I think it's not that setting is not particularly high risk. I think if there's, certainly a particular oral lesion that's concerning, there's an ulcer, maybe there's a history from the patient suggests that they might be at risk for monkeypox or have an exposure. That's a person who should get tested and should be, referred to a provider who can do that testing for monkeypox. That's probably the most important thing. And then, respirator masks for any of those types of procedures, which you're probably wearing already, although, I have to confirm where we are today with dental guidance. Respirator masks for any aerosolizing procedures in people's mouths are still a good idea, I think. Those would be my first thoughts.
Thank you, Dr. Moss. Dr. Makuria, anything to add to that?
No, I would just say in terms of dental practices that a lot of what we're talking about in terms of how people get it from skin to skin or contact, and in dental practices you commonly wear gloves and other protective PPE, and as Dr. Moss noted, during this current outbreak we haven't had any healthcare worker kind of those type of setting exposures, and people becoming exposed in cases of MPX. And so and standard procedures as you would for your kind of dental practice would be in place to cleaning after patients. And then if they need further referral, or if presenting sick or have obvious lesions, then kind of referring out to their healthcare provider.
We're going to continue the conversation with Senator Wiener in just a moment, but before I get to him, I wanted to give you a chance to answer this question. Do you feel that the state's done everything they can to help support the counties in dealing with monkeypox, MPX? Why don't we start with Dr. Moss first?
Well, I find the State Department of Public Health to be a great partner. We have worked with them, closely. Those are my close personal colleagues too, that I've known for many years, and I feel very supported. I know that even when they aren't able to help us, or when they do things that maybe are a headache at the local level, they are always trying to do what's best for the public health of Californians. And I think it's a really important partnership. And so, that said, I think everybody knows more vaccine, and I know they're working hard on that, from their standpoint. But that's a challenge right now.
Great, thank you, Dr. Moss. Dr. Makuria, anything you want to add in terms of, do you have everything you need to deal with this?
I just will echo Dr. Moss's sentiment, as the state has been a great partner, and I think I'm working really hard in this current outbreak and trying to get resources down from the federal government, and really working and listening to the needs of the local public health department and the counties, but also what's needed for public health growth throughout the state. Just as Dr. Moss mentioned, we do need more vaccine. The vaccine allocation supply is still pretty limited, but that goes up even to the federal level as we're going through this current stages of this pandemic or outbreak. I would also mention just kind of treatments as well is also pretty limited for people who might need treatments. Not everyone needed treatment unless they have really severe disease and immune compromise. So working on those access points as well.
Terrific. Thank you both. I want to have Senator Wiener join the conversation. So great if you both could stay. But let me welcome my colleague in the Senate, Senator Scott Wiener. He has represented San Francisco and northern San Mateo County in the California State Senate since 2016. Scott previously served on the San Francisco Board of Supervisors. Senator Wiener has been very outspoken in regard to the response or lack of response to the current monkeypox outbreak. He is chairing the Senate Select Committee on Monkeypox, which just convened its first hearing on August 9th. I know that there was a lot of interesting testimony during that hearing, which hopefully Senator Wiener can share with us. But Senator Wiener, thank you so much for joining us. Love to get your perspective on a variety of things, but why don't we first start with the state response to monkeypox? You've been frustrated. Tell us how you're feeling now in terms of what we're doing or not doing, and welcome.
Great, thank you, Senator Glazer, and thank you for having me. My frustration is actually not really so much with the state. I actually think that the state, our Department of Public Health, Health and Human Services Agency, has actually been pretty solid since early in this outbreak. My frustration is very much with the federal government, which dropped the ball over multiple administrations, Obama, Trump, and Biden, and once again showed that in this country our public health infrastructure is tenuous at best. I will just say for my community in San Francisco has a very, very disproportionate percentage of the infections. We are about 2% of the state population. As of a few weeks ago, we were at about 80 or 90% of Bay Area cases and almost half of state cases, despite being 2% of the population. And this is also a community. This has been very traumatizing because we were hit so hard by HIV/AIDS during a time when the federal government was openly hostile. And so it's for a lot of people, it really brought back some pretty bad memories. And this time, our administration, of course, is not in any way hostile. The Biden administration is incredibly supportive of the LGBTQ community, but we saw some just major shortcomings. We've known for a long time that monkeypox was eventually going to spread outside of Africa. There was something magical keeping it in Africa, and the experts were telling us for a long time. We also have known that the smallpox vaccine was effective against monkeypox, and it was approved in 2019 specifically for monkeypox. And yet, a while back, the federal government allowed over 20 million doses of this vaccine to expire and didn't replace them, and then made some real fumbles early in this outbreak that set us back. That's why Europe and Canada got ahead of us on vaccination, and it really caused some unnecessary problems. So we have been very focused on trying to get more vaccine for California and then have it sub-allocated in the right way. We've also been really pushing the federal government to do a few things. First of all, the treatment that was just referred to, TPOX, it's approved for smallpox, but it has never been approved. And you may have said this already. Please stop me if I'm repeating something. Never been approved for monkeypox, but every treating physician I have spoken to has told me that it appears to be highly effective for these really painful cases, and just like within 24 hours, starting to have a real impact on the pain. And yet it takes about 2 hours of paperwork for a physician to get special permission from CDC to prescribe it. So I was talking to a Kaiser ER physician about a week ago, and this is an ER physician, the most like frantic kind of medical practice. He has to, when he has a patient who comes in extreme, excruciating, unbearable pain, he has to spend 2 hours of his time on paperwork to get permission to give pills to this patient that he knows will help the patient. So that needs to change. And I think for my community, for members of the LGBTQ community, there are a lot of people who wonder if this were a broader outbreak affecting straight people in significant numbers. We sort of are pretty confident the FDA already would have granted some sort of emergency use authorization to get this medicine out there, because there's no supply issue on TPOX. We are also trying to get the federal government to grant more flexibility for federal COVID dollars to be able to allow counties to be able to use them or parts of them for monkeypox. We have a nonprofit in the Mission, San Francisco, that has several nurses that are funded by federal COVID dollars. Those nurses are not allowed to provide any kind of monkeypox treatment, vaccination, anything. So we've asked the federal government for more flexibility. We also need to acknowledge that our county public health departments were underfunded before the pandemic, were incredibly stressed during the pandemic, and need support. And so their counties are going to need to stand up more vaccination capacity, testing, outreach. And so we put in an emergency budget request for the end of our legislative session to allocate about $40 million for the monkeypox response. And I'm optimistic that we're going to have a robust budget allocation. So those are a few of the things that we're working on. I know that there are issues with, a lot of the vaccines have come into, the most impacted areas, including San Francisco. LA gets its own allocation directly from the federal government, but there are other parts of the state, for example, the Palm Springs area that are, and certainly I think the East Bay falls into this category, that have at-risk populations and need more support.
And Scott, well, thank you, Senator Wiener. Thank you for all that you're doing, for your leadership. We're hopeful that these additional resources will happen. I think in the next week or so, we should know, right, on the budget allocation. And what do you think the biggest misunderstanding is about MPX, monkeypox?
The messaging has been really complex around this, and I think the reason it's complex, it's for really unhealthy societal reasons. Society doesn't like to talk about sex. There's a lot of stigma around sex. There was this very inconsistent messaging. The whole monkeypox is affecting, almost 100%, over 97, 98% are gay and bisexual men, and especially men who have multiple sex partners, and so the criteria for getting the vaccine were limited to people who have had recent STIs, are engaging in sex work, have multiple sex partners, etc. That's correct. That was the correct approach. But I think there was also a hesitancy to talk about it in that way. And instead it was like, oh, monkeypox, anyone can get monkeypox. Well, that's technically true. Monkeypox, anyone, but there were certain people who actually have been getting it. And so it was a combination of this confusing messaging about that anyone can get monkeypox. And so that put more stress on the vaccine supply, so people at the highest risk were struggling. What it also meant was you had people who should get the vaccine who didn't want to wait in line in public view, when anyone looking at that line could say, oh, those are all people who have multiple sex partners or had an STI or sex workers. And so it was just it's been a very, very challenging kind of situation. I think there is a lot of misconceptions because of that, but a lot of shaming just because of society's aversion to talking about sex.
And so that's not protecting privacy rights. Dr. Moss or Dr. Makuria, thoughts from you about maybe the what you think is the biggest misunderstanding about this virus, and if you could speak to the privacy issue, is that a concern, or maybe because the outbreak has not been as significant in Alameda or Contra Costa that concern may not be manifested yet? Dr. Makuria, any thoughts on those two subjects?
Yeah, I think in terms of the privacy, although we've been planning vaccine clinics, and we do understand that we want to make sure people's privacy is held. For our planning purposes, we had really no lines, appointment only, to ensure there's less visibility or outside for people who might feel like they don't want to come to vaccine and really have it more and get vaccine open and available. I do think it has been challenging in terms of the communication at times, and we are seeing MPX really affecting a certain community and social network, men who have sex with men, as Senator Wiener reviewed and pointed out, and kind of ensuring that we capture that information, that people know that information. Technically, everyone can get monkeypox, and there has been people outside of that group who've gotten monkeypox due to close intimate contact that wasn't necessarily sexual, but by and far, and by mostly, and what we're seeing for this current outbreak is mostly sexual contact, mostly intimate contact that is kind of spreading the MPX, and really being clear that is what we're seeing and the risk in the population of who we're trying to focus our efforts on with vaccine, with even as it's a limited supply, is important. And we do want to hear the community and the groups, and we have in Contra Costa had some stakeholder meetings to understand how to communicate well, understand the needs of the community, and ensure that we're working together to get the message out and really get a good targeted approach to get the vaccine out there and information out there.
Yeah, that's good to hear. Dr. Voss, thoughts about most misunderstood and privacy and these topics? Any thoughts?
Yeah, absolutely. And I also want to just thank Senator Wiener for his leadership, and also I think touched on a lot of the challenges and issues, the language and how we're talking about MPX, not the least, and those echo conversations we had internally about how to navigate the territory. I would say one of many tricky issues is, and along those same lines, is just making sure that we're opening up channels for vaccination that meet the needs of people who are comfortable going and staying in line at the Oakland LGBTQ Center, or getting an appointment, but getting services there, and then people who want to go to a different type of setting. And often we're, in Alameda County at least, we're talking about people who are impacted, who are either because they're gay men or bisexual men or transgender persons, or because they're monolingual Spanish speakers, or immigrants, that they have a variety of barriers to accessing care, for different things. And so I think the challenge for us is how to create avenues that meet the needs of our communities that are being affected, when the regular health system does really great at certain things, but not always at meeting the needs of these men, or men and women, I should say, but particularly men. And so I think that is the challenge, and it is tightly linked also to the communication issue, how we talk about MPX with our community members and how we, how we orchestrate our overall response.
Very good. We're coming to a close here in this conversation. I want to give each of you a chance for some summing up comments. Again, thank you so much for your participation. For all those who have been listening and sharing their questions, Senator Wiener, why don't we start with you? You've talked about the bureaucracy that's getting in the way, the availability of medicines and the like, the slow response from the federal government. Any other summary, and of course your leadership in trying to get more resources to the county for public health. Any summing up comments as we move forward?
No, I think, it's interesting. I know you probably noticed, we all saw, I think it was yesterday, that Dr. Walensky at the CDC announced that they were doing some deep introspection at the CDC around some of the major failures during COVID. And I think that really spilled over here with monkeypox. And so I think at the federal level, we need just some pretty deep reform at CDC and the FDA as well. We all remember during, through COVID, some of the failures there. And I think, I think our state and local public health departments have all really stepped up. But it's once again shown how flat-footed we are just in the US around public health response. And I hope that we learn more from COVID, but I'll tell you, every year in the budget, just trying to get more funding to beef up our county public health departments. It's a fight every year. And we're finally this year able to get about $200 million just in basic support to help our county public health departments rebuild. It wasn't enough, but we need to take it seriously. But there have always been new viruses appearing, but I think especially with climate change and habitat encroachment, we're just going to see more, and we need to get more nimble and be more forward-thinking and more prepared.
Thank you, Senator Wiener, and I've so enjoyed working with you on this, on COVID, and I really appreciate your leadership. Thank you for sharing your thoughts and being a part of this conversation. Dr. Moss and Dr. McCrory, I want to give you the same chance to close. I did just get a question from Michael asking that he went through the California website to get his initial COVID vaccine. Can he do the same with the MPX vaccine? Why don't we start with Dr. McCrory? If you know the answer to that, share it. But otherwise, other summary thoughts.
Sure. At this time, you can't use the California website to get the MPX vaccine. In terms of final thoughts that we have, we've been working hard to get vaccine out to the groups that have been most affected. And so if you're in Contra Costa County and are looking for vaccine and you're eligible, please visit our website at cchhealth.org/MPX for more information on vaccine and efforts that we're doing within the county as well. We are partnering, as mentioned, with the Rainbow Community Center for vaccine clinics, and then other community partners as well. If you're concerned for MPX, definitely follow up with your healthcare provider to review potential testing. And then if you have MPX and have severe symptoms, also follow up for potential treatments. And just want to thank you, Senator Glazer, for having me here today.
Thank you so much. Dr. Moss, thank you for participating. Any summary thoughts?
Just wanted to echo Dr. Mercurio's thanks for having us here to share this information and to take the opportunity to share. If people have questions for Alameda County, it's our email address, monkeypox@acgov.org, and the phone number with monkeypox questions, 510-268-2101. And again, we're moving over to using MPX, but those contact, you'll still be able to use that email address. And I also want to take the opportunity to thank the state legislature's efforts to support public health infrastructure. Absolutely hugely needed for us to keep doing what we're doing to try to support public health. I just in brief would say, these things will continue to happen. Maybe not to the scale of what we've experienced with COVID, hopefully not anytime soon, but these things do happen. Health issues come up. There are, communicable disease issues and other challenges, heat, smoke, things like that, that we are trying to grow and respond to and find the best way to support our communities through. And we really appreciate, your work and others' work, and of course, our community's support of what we're trying to do, which is really to get people through MPX, but also these other things as healthily as possible.
Well, thank you. And thank you both. This conversation is all about getting facts available to our community from experts such as both of you and Senator Wiener. If you want to view this conversation, it's going to be on our website. You can go back and listen, share it with a friend. That's sd07.senate.ca.gov. You can use the links below the video screen, which will provide the latest information from the CDC, the state, and the county public health departments. I hope that this virtual town hall can help folks understand how this crisis is affecting all of us. I want to encourage all of you to stay safe, practice healthy public interactions. And I want to say thank you again, and I hope you have a wonderful day. Thank you all.